largely with mental health over the years, for us as an ambulance service, it was always A&E is a place of safety for patients experiencing sort of a real crisis.
Is that still the case now, or?
I think it's less so. There's more pathways now, and which is a good thing, because A&E are overrun. They've got so many other demands on their expertise, and managing a mental health situation is very, very challenging. It's quite resource heavy, so I think it is a place of safety if the patient stays there, but they can't restrict and restrain.
So what would you recommend to those people that are, going through something, like severe mental health? Then would you suggest they go through their GP, or is there a particular contact they need to make with a particular organisation? Or
I think if they're in the early stages of feeling like their mental health's declining, definitely primary care through GP. So reach out and get in contact with your GP. They'll be able to signpost you generally to some of the organisations that are out there that can support, and also a lot of the primary care network now have the mental health support workers, so they have access to those guys and girls that can provide that first line level of support and signpost to support groups, support agencies, that sort of thing. I think with the more extreme if things were unfortunately taking a bit of a turn, then there's obviously Samaritans and the sort of more crisis mental health hotline, that sort of thing.
Yeah, I think that's really useful for people to know where to turn to. I think that seems to be the majority of the issues at the moment, is that they really don't know who to turn to, especially if they have no support network themselves from family or friends. I think
it's important for us to obviously highlight what you just said as well, and I think we'll try and provide some information in the description below as well, about who to contact if you are kind of going through a tough time. And it's so very, very common now, and people kind of think it's still a bit taboo. It's still a bit of a situation that they don't really want to approach, and they're trying to suffer alone. So definitely we will obviously ask you to provide any sort of information, which we'll
be happy to. It is really challenging. We've all got our physical health and our mental health, and the two go hand in hand. If one suffers, the other the other can be affected. We'd all think nothing of going to see you guys at the pharmacy or to the GP if we've got cough and cold symptoms and that sort of thing. But if we start struggling with our mental health, we always tend to withdraw a little bit and step away from asking for help. But actually, it's really important to do that.
It's very easy to hide as well, I think, with mental health. Like people with physical issues, then it's a lot difficult to hide sometimes. You can see it plain sight, but people, you just have no idea kind of what they're going through sometimes until you really do approach it.
Absolutely.
Did you find that in your situation as a paramedic on the road, were there kind of repeat people that you had to kept coming up, and how do you deal with those if you know that almost this is going to be a similar situation again? Because you get that sometimes in the pharmacy where similar patients keep cropping up, similar medication keeps going missing, or you don't want to say that it's a waste of time or anything like that, but what do you do in those sort of situations?
It's really difficult. You have to treat each one almost as a separate case and a new case, because you just never know if that time, if they, especially if they've threatened to harm themselves in some way, you can't sort of make the assumption that they've done that before, it'll be fine this time, because it might not be, and something different could be happening, and there's other reasons why your mental health gets affected, and it could be a physical health condition that's exacerbating their mental health, so that's something you could have an impact on, so it's really important to try and take each case on its own merits and judge it each time, but very easy to feel.
I can imagine
this is
X here we go again, sort of thing.
For the umpteenth time. And we certainly had our regular callers who you got to know and their needs. I can remember one mental health patient with certain needs, but every time we arrived, it was literally just because they needed us to pop to the off license and buy them a bottle of something.
Really? And would you do it, or?
Well, it was one of those situations where if you didn't, then you just kept getting called back. But then if you do, you're sort of feeding the problem, aren't you? So it's really really challenging.
Does it ever cross over to the point where it's almost a crime, or if you're wasting just the resources?
More recently, I think, and certainly in my latter part of the career in the ambulance service, we were noticing there was teams tasked to looking at those regular callers and trying to help manage their situation. So that would be usually pulling in sort of multidisciplinary professionals to say, okay, so who in this arena can support, who in that arena can support, and then trying to minimise the effect they were having on all services, really, not just us. So that became more apparent as the years went on, I think, because we started to notice these trends in in those types of calls. So it was a good thing, and I believe that's still going.
That's really good.
Now.
It's good to know that how it's evolved into trying to solve the actual issues of
absolutely.